Let me introduce myself. My name is Prabir Roy Chowdhury. I'm a nephrologist at the University of Arizona and also the ASN co-chair for the Kidney Health Initiative. And on behalf of our FDA liaison, Kristen Miller, the Kidney Health Initiative Board of Directors, and the Patient and Family Partnership Council of the Kidney Health Initiative, and also the organizing committee for this meeting, chaired by Paul Conway and Kathy Tuttle, who's just walked in. Welcome, Kathy. It really is my distinct pleasure to welcome all of you to our 6th annual stakeholders meeting. In particular, and I'm going to try and show some slides. Could I get the first slide up? Could we get the next slide? So I will say that, that this is by far our biggest gathering. So we're probably 30% over the previous highest number of people we've had. Thank you. So next slide, please. So I particularly wanted to welcome a very large number of new members. So thank you for being here and welcome to the Kidney Health Initiative family. For our new members, and also for some of you, I just want to emphasize again that the Kidney Health Initiative is a public-private partnership between the U.S. Food and Drug Administration and the ASN. It was formed in September of 2012, and our goal is really to promote both innovation and patient safety in kidney disease. Now, the way we want to do this is by doing projects in 5 well-defined strategic priority areas that go all the way from patient and family partnerships to closer interactions with regulatory agencies to clinical trial, endpoint and design studies to the improvement of clinical trial infrastructure. And our goal really is, or our hope really is, that the output from these projects, be they white papers or data standards or workshops or a roadmap, as you will hear about, will actually be able to facilitate the passage of drugs, devices, and biologics into the kidney space so that we can take better care of our patients. To date, we've done over 18 projects. 8 of them have been completed and have resulted in almost 15 different white papers. And we also have 10 projects, if I could get the next slide, right? We have 10 projects that are currently ongoing. And you're actually going to hear about some additional project proposals that have come into the Kidney Health Initiative over the next day and a half. Regardless of the projects that we do, though, the greatest strength of the Kidney Health Initiative, in my mind, is very clearly its people. So that's really all of you. And within the Kidney Health Initiative and in this room, we have representation from device manufacturers and dialysis providers and pharmaceutical and biotechnology companies, so both large pharma and small biotech. We have representation, very importantly, from patient organizations, from research institutions, and from a large number of different health professional organizations. And then very, very importantly, we're a partnership with the FDA, but we also have good representation from other federal agencies, which I think is critically important, from NIH and CMS and from CDC. More important than all of the projects and the people in a way as well, the one message that I want to give to all of you, especially those who are attending this meeting for the first time, that this meeting is a wonderful place to interact with a whole variety of different people, with all the stakeholders in the kidney field, really. It's a great time to network. It's a great time to connect. It's a great time to learn and also both be educated and to educate. And again, in my mind, it's just a great opportunity to be able to link up different ideas and projects and people together so that the project as a whole or the idea becomes that much more impactful. And I do want to say that everybody on KHI's staff and on the board of directors, we want to hear from you. We want to hear your ideas. We want to hear about how we can do things better. And then finally, in my last 2 slides, I really do believe that this is an exciting time for kidney disease, from rare diseases to chronic kidney disease to end-stage renal disease. And The Kidney Health Initiative is interested in all of these areas. I think we've got a lot of interest from a variety of stakeholders. You're going to hear about the Kidney X initiative or the Kidney Innovation Accelerator. We've got the Kidney Precision Medicine Project from the NIH. But I would argue very strongly that if you're a patient in this room, from the patient perspective, I'm going to go back to the previous slide, from the patient perspective, there is still a huge amount of work that needs to be done and a lot of progress that needs to be made. And in fact, if you're a patient, you could very well argue that there isn't that much time and that all of this that we're doing today should in fact have been done yesterday. And that's the reason why the theme of this meeting is patients at the center. I want to emphasize a phrase that Kathy Tuttle used at the end of our last meeting, which is, we are all patients, and I think that is true. And I want to read out again a paragraph from a paper that Drs. Falk and Lindy published a couple of years ago, which basically says that if we fail, and by we I mean all of us in this room, including patients, then we fail our patients who will continue to suffer unnecessarily while observing the cascade of cures for other diseases and wonder, why not them and why not now? So with that, welcome to this meeting. Thank you for coming. I'm going to ask Paul Conway, who's the co-chair of this meeting, to come up and just say a few words as well. Paul?
Well, thank you very much. And my name is Paul Conway. I serve as president of the American Association of Kidney Patients, and I also serve on the board of the Kidney Health Initiative. And I want to say, as a patient, it's a distinct honor to be a part of KHI. The American Association of Kidney Patients was founded in 1969 by 6 patients who were receiving life-saving dialysis care, who looked at themselves and looked at the world and thought, what does it take to extend this benefit to everybody? And in the right model of patient engagement, and they really became the historic model for what was effective, those folks came together and they worked very diligently as volunteers and as patients, and they worked with medical professionals, and they sought out a nationwide effort to bring this issue of dialysis care and coverage to the United States Congress. And that led to a patient, Shep Glazer, being dialyzed on the floor of the House Ways and Means Committee. Now, try to go ahead and do that today. Probably pretty impossible. But the interesting thing was that actually led to the passage of the modifications in the Social Security Act, which we now know as the End-Stage Renal Disease Act. It was signed by Richard Nixon in 1973. So although these words get batted around quite a bit right now, and there's a lot of people trying to research and figure out what is patient engagement, it started in 1969 at the minimum in this field, and by doctors 10 years earlier than that. So that's why for us it's an honor, because we're trying to honor a legacy. And at KHI, it has a couple of different elements to it that I thought I'd just mention briefly as a patient. I've had the good fortune to live on a kidney transplant. Last week I celebrated my 21st anniversary of that. I had done 13 years of the honor goes to my donor, 16 years old, and told his parents he wanted to be an organ donor. And they consented, and that's why I'm here today, because benevolence and kind actions do happen. But as a patient, I've been able to be involved in public policy for quite a long time. I've served under 4 presidents and 3 governors. I kind of understand how things work. And KHI, to me, is a model of how you actually get things done. And let me give you a couple of perspectives. For medical professionals who are here, what you will find in this environment at KHI is a respect for your profession. You'll find a respect for your interest and imagination and inquisitiveness. And it's welcomed by all sectors. For those who are in government here, and if I could just see a show of hands, United States civil service and political appointees, regardless of administration, these are the folks that work for you, they work for the United States, and these are the folks that invest 18 to 20 hours a day, bringing issues to the forefront and getting them solved. These are great, great experts. For patients and for industry, we couldn't be where we are now without them. And in this environment, it's safe, there's open discussion, they listen to where roadblocks are, potential barriers, they bring truth to that, because sometimes there's perception that's not accurate. For industry, you'll find this. You'll find that you have many passionate people here, but at the end of the day, there's no judgment made on the fact that this is the United States of America. It's free market health care. So you have the courage to go out to find investors to drive innovation and to identify things that many people don't see and to connect the dots. And as a patient, we salute you for that. There's a lot of talk that goes on about that, but just understand that in this environment, we understand that nothing can get done without the private sector. For those who are involved in research, you'll find an interesting environment here as well, because innovation is welcome, leading edge research, patient-reported outcomes, real-world evidence, patient preference information, that's welcome too. And as a patient, we'd encourage you to lean forward so we can cover more ground faster. And my last thing here that I'll mention to you is as a patient with fellow patients who are here. You have the Patient Family Partnership Council, which is an advisory body for the KHI. You also have many other patients who will come and attend, and I can tell you what KHI is not. KHI is not a patient petting zoo. And what do I mean by that? What I mean is it's not a petting zoo where researchers simply check off boxes. You're interested, that's fine, now sit down. It's also not an environment where quote-unquote professional patients are maligned or cast aside. Everybody brings a patient experience, but what is also interesting is people bring a level of expertise and seriousness, regardless of how long they've been battling it, and it's welcome. It's open territory. And this is what fusion is. Everybody here together, not challenging each other's profession, not challenging each other's occupation or experience, but the challenge goes to what does it take to get there next? And it's been like that for 6 years. It's highly stimulating. You should be honored to be here. We're honored to be here, and I think I speak on behalf of all the patients at least. Thank you for what you do, every sector, because literally we would not be here today if it weren't for you. And thank you for the opportunity. Thanks, Brittany.